Okay, somebody tell me, what do you actually know about musculoskeletal system, or what do you know about bones? Okay, see, uh, particularly, when compared to all other, okay, right? It's a hard connective tissue. They look white on X-ray. Okay, structure that help to the body movement, contain minerals like calcium. Okay, there are long bones, short bones, flat bones, and irregular bones. Okay, seems at least you know something about it. But let's try to actually understand why is it important for you know why is it very important for a doctor to actually know about the bones. You see here, when compared to the a chest X-ray, which has an indication whenever there is a cough, or whenever there is some kind of a respiratory problem, we came to understand that yes, chest X-ray is one of the most frequently done investigation done in a radiological department prescribed by the general physicians. But when compared to that, actually, it's not the chest X-ray which is frequently prescribed into a radiology department. It is the musculoskeletal system X-rays that actually come in thousands every day into a hospital. You know, doesn't matter what kind of a person it is. It doesn't matter what kind of a patient you are looking at. Everybody is going to have some kind of a problem. Uh, with the related down to the musculoskeletal system. For example, to say we often meet people who say that they have the joint pains, and sometimes we see the youngsters being admitted down into the hospital due to a traumatic injury where fractures seems to be the one of the biggest problem. So whenever somebody is perceiving a pain, which might be related down to the joints, okay, other than the visceral organs, okay, which are completely soft tissue structures, all other pains that are much more worse or make the people suffer a lot, and the most kind of a frequent problem is related down to the musculoskeletal system itself. So uh, comparing with all these kinds of history, we actually can say that the musculoskeletal system problems are the ones that are mostly frequented by the patients into a hospital. So musculoskeletal system radiographs generally are the ones that are prescribed more frequently than when compared to a chest radiograph. Yes, but the problem here is that both of them, both the chest radiograph and the musculoskeletal system radiograph, comparatively, musculoskeletal system radiographs are higher in number because that is the one of the most important complaint that anybody comes down to a hospital. Okay, somebody says joint pain, somebody says knee pains. Okay, somebody is hit them with a car, or somebody met with an accident likely to have fractures, all of them that is related down to the musculoskeletal system itself. So we can comfortably say that a musculoskeletal system radiograph is one of the most frequently prescribed radiograph investigation that is coming down into a radiology department. But you have to understand one thing here. It doesn't matter either you have a symptom or either you doesn't have a symptom, but still you are not liable to prescribe a musculoskeletal radiograph unless and until it is indicated, right? So even the same rule applies down for the chest radiograph as well, right? Unless there is a complaint that is related down to thoracic system, respiratory system, you are not liable to prescribe a chest radiograph. That's the same way unless and until you do not have an indication which is actually telling you about some kind of a provisional diagnosis that is related down to musculoskeletal system, you are not required to prescribe a musculoskeletal radiograph. For example, to say we take a 60-year-old female comes down to the general physician with a frequent complaint of you know knee pains while walking, and there is some kind of a stiffness whenever she is trying to move her joints, and it happens mostly in the early in the morning. Okay, what kind of a history do you think? What kind of a disease am I talking about here? Do you have any idea? Okay, 60-year-old female actually comes down to the general physician with a complaint of right-sided knee pain, and she has been complaining that the pain actually aggravates whenever she is walking, and that she used to have stiffness whenever she tries to move the joints. Then so what are we thinking about it? Okay, we are thinking about rheumatoid arthritis. Okay, rheumatoid arthritis. Somebody says osteoarthritis. So here, do you think that you need to prescribe an X-ray for this woman to actually know if it is an arthritis condition or not? Do you want to do that? Okay, Arslan says no. Okay, Reshma says yes. But why do we have different opinions here? Somebody says yes, somebody says no. Why do you think that we have such kind of a problem here? Okay, why Arslan thinks no? Okay, we go for a blood test in RA. Okay, interesting. Okay, now let me say, if the same kind of a history, with the same kind of a history, now it comes down to a 13-year-old boy, let's say. Let us say he's not having knee pains, but he's actually having wrist pains. Okay, 60-year-old female actually has got knee pain, whereas our 13-year-old male has got a wrist pain. Okay, do you still think that who gets the X-ray? Both of them needs to have X-rays, or only one person needs to have X-ray? Okay, if somebody needs to have an X-ray, you need to tell me why, and somebody doesn't need to have an X-ray, you tell me why. Okay, is it 13-year-old male who gets the X-ray, or is it a 60-year-old female who actually gets the X-ray here? Anybody? Okay, need to have 13 need to have. Okay, why do you think so? Male. Okay, why do you think so? So, Arslan, do you think that this guy actually needs to do some kind of a test that is actually related down to RA? Okay. So, is it something that you already know as a logic, as a the thing that you have known as a medical fact that okay, rheumatoid arthritis occurs in female in older age, so that's the reason you think that you have already confirmed your diagnosis? So that's the reason you are trying to avoid an X-ray here, or is it something else? Okay, Reshma says congenital syphilis. Okay, rubella. Okay, I think you are talking about congenital rubella syndrome, osteomyelitis, or different bone problems. Okay, which patient are you talking about, Reshma? The kid? Okay, you think that the 13-year-old kid has got congenital rubella syndrome? Okay, forget about these two guys for a while you are actually trying to. Okay, so you mean to say that here, since there are so many diseases that actually needs to be differentiated when it comes down to a musculoskeletal system, so you will actually go for X-rays for both of the patients, yes? Is that what you mean, Reshma? Okay, okay. Right. Okay. Let's forget about those two guys, okay, who are probably really sick. But let's try to say, yeah, I was actually, while one day I was actually walking on a road, and suddenly I got to feel a little bit of lower back pain. And yeah, and it gone away after some time. And then what actually happened is that after a few days, I actually came back uh, while I was working back in my home. What I actually got is that I started to feel a little bit of, a very faint pain in my lower uh, lumbar region on the backside. Okay. So I went to a doctor, and the doctor actually asked me what kind of a problem do I have. I was saying that I was having a little bit of lower back pain. Now, do you think that I need to have an X-ray? Aman says no. Okay, Ankita says no. Debelina says no. Okay, why do you guys actually think? Why is there such kind of an? Okay, Reshma says yes. If the pain is persistent, yes, maybe. Okay, right. Okay, Reshma, could you tell me actually what is the disease that you are thinking about? I might be facing here. Okay, some let us say a male comes down to your clinic and says that he has got some kind of a lower lumbar pain, and you think that you are X-ray. Okay, you are thinking about spondylitis here. All right. See, and why does Aman, Ankitan, Jabalina, and other guys says that I don't need an X-ray? Okay, don't you agree with Dr. Reshma that she's thinking that if it is spondylitis? Don't you agree with her? Okay, same problem happened with you, and the doctor did not prescribe. Okay, you didn't went for an X-ray. Osteoporosis. Reshma says osteoporosis. Okay, I think we should start exercising and try to resolve the pain. Okay, seems to be a fair enough answer for me, Aman. And actually, you see here, uh, this is one kind of a real deal here. Okay, so many patients. Let's say that you are staying down in an orthopedic department. Okay, orthopedic medicine, or if you are trying to stay down in the orthopedic surgery department, what actually happens is that we will be confusing ourselves with a lot of differential diagnoses. And for particularly speaking, that there are something around like 206 bones in our body, and for every bone in our body we can actually prescribe an X-ray. That's we know actually as a fact. And after we have completed our radiology basics, we think that okay, every bone can be having a visibility on a radiograph, okay, on a conventional radiograph. So that's the reason we can actually visualize it everywhere, and we can try to prescribe an X-ray whichever is related down to any kind of a problem which is related down to the bones. That's what we think. But some kind of a person like Dr. Ankita or Dr. Aman thinks that some kind of a rational way, and thinks that yeah, maybe there is something else. Okay, we have to go for a natural measure, or we are trying to go with analgesic medications. Yes, Ankita, if when you had same kind of a problem, you know when you had same kind of a problem, what did the doctor do to you? Actually, he did not go for an X-ray. So what did he do? Did he talk like Dr. Raman and say that you should start exercising and try to resolve the pain? Okay, he went for a blood test. Okay, what kind of a blood test did you take? Okay, you went for uric acid. Okay, I think it should be normal, and it came back normal. Okay, it came back normal. So what did the doctor think? Okay, since your uric acid came normal, okay, what did the doctor think? And then to lost weight. Okay, all right. You were advised to lose weight unless you are something around like an obese person who his BMI is something around like 28. Okay, so what is it? Okay, I think of osteoporosis due to lower calcium level after menopause. But I am a man. I don't have a uterus, so I will not have menopause either. I'm talking about myself here. So how are you justifying menopause and osteoporosis here? Deficiency was there. What kind of deficiency? Okay, you had vitamin D deficiency. Ankita had vitamin D deficiency at 20 years, 21 years. Interesting. Okay. All right. So now you see here we got three patients which are related down to having three kinds of problems. Okay, everybody we try to understand actually who needs an X-ray and who doesn't need an X-ray by the end of this class. But exactly, let's try to analyze why actually a person that is related down to a musculoskeletal system actually tries to get down with a complaint of pain. Okay, why do you think that there is a problem like this one? Because you see here, we our body is made up of 206 bones in an adult. Okay, and the musculoskeletal system actually helps the human body to maintain a posture, and also it is actually helping down to have locomotion. Okay, so we are trying to we are trying to the mostly these all these bones are actually trying to give some kind of a structural orientation down to the human body, and also at the same point of time it actually provides the skeletal system actually provides locomotory functions. And when actually the human beings came down from the four legs to a position of bipedal position, okay, we are started to stand on two legs. Actually what actually happens is that our locomotion actually changed a lot. So the bones are organized in such kind of a way that actually it gives support to the whole human body. Okay, that is the main function of the musculoskeletal system, and it actually maintains the structure of the human body. Okay, but that is actually related down to anatomy, but when it comes down to the physiology or biochemistry, actually, it is about the deposition of the calcium, which is related down to the endocrinal system. Okay, endocrinal system where the parathyroid hormones, thyroid hormone, uh, and is necessary for the calcium metabolism, which is related down. And calcium is a very very important uh, ion, okay, or which is a very important mineral that is actually necessary for us to do a lot of physiological functions. Well, for example, to say if we are trying to have smooth muscle contractions, okay, if we are trying to have nerve conductions, yes, calcium seems to be a very, very important ion that is related down for all kinds of physiological functions. Okay, so that is the one which is actually the bones are the main organs which actually maintains the calcium deposits. Okay, you can actually call the bones as the storehouses of the human body. Storehouses of calcium in the human body are the bones. But while I actually asked this question, can you answer me one question? Okay, what is the strongest part in our body? What is the strongest bone in our body? Reshma says femur. Ravi says femur. Arslan says femur. All guys says femur, but you are mistaken, guys. But it is not the femur which is actually the strongest bone. It's your tooth, the teeth bone. Okay, the teeth are also bones which has got enamel on them, which is the strongest material till date. Okay, so enamel teeth are the one that actually are the strongest. Actually, when I'm trying to ask you such kind of a questions, they might be a little confusing, but let me once for all try to remove off your confusion so that you can actually try to remember what exactly these things are. Okay, femur is considered down as the longest bone in the human body. Okay, it is not the strongest bone, but it is the longest bone. All right. Okay, tooth generally it doesn't actually form down onto a musculoskeletal system, but still yes, it is the strongest one because it is made up of calcium also, but the strongest material actually is the enamel. All right. But femur is the longest bone in the human body. Okay. Then, when it is the longest bone, can you tell me what is the shortest bone? Okay, stapes. Okay, the inner ear ossicles. Okay, the inner ear ossicles, out of which the stapes seems to be the smaller bone in our body. Okay, inner ear ossicles, you call them as malleus, incus, and stapes. All right. Okay, then now you tell me again. Let me ask you a question. Forgetting about the teeth, what is the strongest bone in our human body? I think last time at some point of time when we were talking about which is related down to calcium, I think I have told you this answer, but you tell me again. What is the strongest bone in our human body? If you can remember my previous classes, I think I have already mentioned about this one to you guys, but let's try to recall about that. Okay, it's not mandible, it's not tibia either. No, of course, femur is the longest bone. I'm talking about the strongest bone. And no, okay. The answer to this question, the strongest bone in the human body, is temporal bone of skull. Okay, Jabalina, either you referred it or either Copody, yeah. Okay, either you have referred it because you were answering it as femur before, but right now you came up with an answer. Temporal bone of the skull is actually the strongest bone. The reason for this is actually, it has got the Haversian canals, which are the main uh, tissue that is actually forming the bone connectivity, the connective tissue that actually once forms the bone integrity, that actually maintains the bone integrity, is actually horizontal. Okay, horizontal Haversian can also actually makes the temporal bone of the skull seems to be the one of the strongest. Okay, when such kind of a question comes, what is the weakest bone of the human body? Clavicle. Actually, clavicle is not technically a very weaker bone. No. Okay. Uh, some way or the other, you can actually say that clavicle is one of the weakest bones. Yes, true, true. Lacrimal bone. Okay, lacrimal bone is the weakest and the one that is also completely insecured. All right. Okay, fine. Okay, then the longest bone is femur, the smallest bone is the stapes, the strongest bone is the temporal, and the weakest bone is the lacrimal. Okay, but now a real important question comes down to you. Do you know the names and the parts of all your bones of the body? There are 206 in it, 206 bones in an adult skeleton. Okay, do you know all the names? Who doesn't know them all? Hmm? Does everybody know the names of your bones? Completely 206 bones? Have you learned that in anatomy? Okay, right. So forget about it. Generally, okay, we will try to cover that as the time comes on. Okay, when we are trying to deal about the regional anatomy of the musculoskeletal system, then yes, of course, I'm going to talk about all these things once again. But whenever actually before getting down into these classes to understand a good information to have a better understanding of the musculoskeletal radiology, I think you need to know these basic things. All right. try to understand, okay, the homework for you for the coming next 2 weeks is actually that you need to try to learn the names of all your bones, okay, 206 bones and 753 muscles in the human body. Okay, you have to know their origin, insertion, blood supply, nerve supply, the names of all 206 bones and the joints which are related to them. Okay, regional anatomy of complete musculoskeletal system. I guess you need to by heart it. Okay, if you are not going to understand, if you do not actually know the names of these things, what actually happens is that you are going to perform poorly in musculoskeletal system and as well as central nervous system. All right, because I'm going to deal about a clinical orientation that is related down to both musculoskeletal system as well as central nervous system in the coming classes. All right, so if you don't know about the functions of all these muscles, if you don't know the functions, origins, insertions, nervous supply, blood supply, and also do not know anything about the joints or joint mechanisms, okay, you are not going to understand anything that is related down to musculoskeletal radiology. That's the biggest challenging part. Okay, I just want you to know the names. I don't want you to know the theory behind them, because I'm going to tell you whenever a disease comes over. Okay, we will be talking about clinical scenarios. So I better suggest you keep on working with the musculoskeletal system. All right, it's a big task. It's a big task. I know it is difficult, but still it is very easy. And I will try to make it easier so that you can actually remember the names of the bones, origins, muscles, nerve supply, and the blood supply. Okay, we will try to do it. Okay, right now we'll start with a normal bone anatomy, which is related down to microscopic structure as well as radiographic structure. Okay, now you see here, like I have been telling, okay, conventional radiographs actually bones consist of a dense cortex, okay, which is the outer covering of a compact bone that actually, it actually envelops less dense medullary cavity, which actually contains as the cancellous bone, which are known as the trabeculae. Okay, first try to understand whenever you are trying to look at a uh, skeletal radiograph, whenever you have visualized a bone over a radiograph, what you actually see is that you will be seeing that there is a dense white line. Okay, a dense white line that is actually coming out of the bone, which is actually present to the peripherally of the bone edges. Okay, we call it as the cortex. Remember that, and that one is actually the real part of the compact bone. And then which actually envelops a less dense medullary cavity, which means to say it is the central in position. Okay, the medullary cavity, the medulla, the bone medulla is actually present down in the center, which is less dense, which means to say it is appearing a less white, okay, and which is actually called as the cancellous bone. And in microscopically speaking, okay, in microstructure, these cancellous bones are arranged in such kind of a way to form the medulla, and those structures are actually called as the trabeculae. Okay, all the trabeculae coming together are the ones that are actually forming the Haversian canals. Okay, and all the Haversian canals together meeting and then finally forms the cortex, and the bone is covered by a thin layer which is actually called as the periosteum. Okay, I think you already know about this one, right? Okay, the cortex of the bone, okay, which has got an outer covering, which is the layer of the bone, which is called as the periosteum. Okay, it is a part of the cortex itself, and that is the real part of the compact bone. And then which has got a less dense medullary cavity, which looks less whiter, and it is actually a part of cancellous bone, and they contain the trabeculae. And you have to understand, in between the trabeculae, they are separated primarily by the blood vessels and the hematopoietic cells and fat, which is actually the component of the bone marrow. Okay, I think you generally know about this. Bones are not hollow structures, okay? They appear to be hollow, but still they are well organized with trabeculae, and they actually contain blood vessels, hematopoietic tissues, and fat, which is actually the component of the bone marrow. And what is the function of the bone marrow? Bone marrow is the one that is actually necessary for erythropoiesis. Okay, these are the one that actually produces blood cells. Okay, and a lot of cell differentiations actually happens down from the bone marrow itself. Okay, so they are called as the precursor cells that are necessary for the differentiation are actually formed down in the bone marrow itself. So bones not only actually provide appendicular skeleton, actually also do not provide the locomotion, but they are also the storehouses of calcium, and they also are the main reason for the precursor cells. Okay, the stem cells in the human body is actually derived from the bone marrow itself. Okay, and you have to understand one thing here, that the proportion of the cortical versus trabecular bone varies in different skeletal sites and even on different locations in the same bone. Okay, see, well, actually, before Aman was talking about the parts of a bone, okay? So the parts of a different parts of a bone actually, try to uh, have different cortical and different trabecular densities, okay? Even in the same bone, or actually in different skeletal regions. Okay, for example, to say the trabecular distribution may be entirely different. Trabecular distribution of the humerus may be entirely different from the trabecular distribution that is present down in the femur. Okay, so you have to understand actually what does this trabeculae are. Okay, why do you think why do you think certain bones are long, why do you think certain bones are short, and why do you think certain bones are regular in shape, and why do you think certain bones are irregular in shape? Okay, what actually determines the shape of this bone? Okay, it's actually the trabeculae, the one that is actually determines the shape of the bone. But why does this actually happen? Okay, the reason behind this is actually, different bones present at different regions of the body undergo different stress, okay, due to the locomotion, due to the weight, due to the gravity. Okay, all these things actually happens, and there is a lot of effect of all these factors. Okay, mostly external factors are the ones that actually determine what is the shape, size, and the density of a bone. Okay, forget about the physiology for some time. Okay, we'll talk about the physiology where the bones do not actually form their own shapes. So the trabeculae are different in different regions in different bones is because of the external factors. Okay, the external factors is that, okay, for example, say the femur has got a trabeculae which are much more dense in the neck of the femur. Okay, and whereas compared to the neck of the humerus in the upper arm, okay, we have that is the weakest part, and the femur also, the neck of the femur is also the weakest part, but still the femur neck trabeculae are much more stronger when compared down to the trabeculae that is present down in the humerus regions. Okay, so the difference actually happens according to the region it is present and according to its functionality. Okay, and in such kind of a situation, you can tell me what kind of a bone has got the much more stronger trabecular distributions. Okay, I told you that it is the temporal bone. Okay, one of that way. And what else? Other bones which also have got the such kind of a very strong trabecular distributions. Okay, any other bone in the body? Temporal bone actually forms down the parts of the calvarium. Okay, so it has to protect the brain, so obviously it seems to be one of the strongest bones. Okay, when compared to the same kind of a function, okay, what else, what other bone do you think that it might be having, undergoing a lot of stress? No, it's not the femur exactly. It's not the femur. Pelvis. Okay, not exactly. Skull. Okay, skull already was there. Hip bone, not exactly. No. No, no, no. It is the calcaneus bone of your foot. Okay, not the feet. Okay, not the feet. When you are talking to say about the feet, I think you must be talking about the the metatarsals and the phalanges. Okay, it's not, they are not the strongest one, but I'm talking about the tarsal bones here. Okay, the tarsal one, okay, the first tarsal, which is the calcaneus, seems to be the strongest one, which is organized with well strong organized trabeculae. Okay, calcaneus bone also, it undergoes a lot of stress and it undergoes a lot of microfractures every day, and it also it undergoes a lot of reconstruction every day. Okay, so tarsal bone the tarsal bone calcaneus is also one of the strongest bones. All right, temporal, after temporal, yes, it is the calcaneus which actually bears a lot of stress. All right, okay, so this is actually one of the biggest example I can say that yes, the trabeculae may be different. And when I'm talking about it can be lumbar vertebrae. You see here, they also undergo a lot of stress, but you have to understand lumbar vertebrae when considered down as a single component. Okay, because you see here, vertebral column is connected by the intervertebral discs, which actually makes it fragile. But when you are trying to look at down the vertebral body as a single component, yes, that might be true. That might be true. Yes, they also undergo a lot of stress, but that stress is not actually the physical force, but actually, it's about the thrust and it about the stress bearing area and the weight bearing area. Okay, the body weight is the one that actually plays an important condition here. Okay, all right. True, lumbar vertebrae also are under a lot of stress, but when you are lumbar vertebrae generally cannot be considered down as an individual bone because you have to consider down the complete vertebral column together. Okay, when it compared to the stress, because they are present down as different components, because they have to undergo a lot of stress and to cause the flexibility. But when compared down to the calcaneus, no, it is not flexible muscle. Okay, it's completely fixed, and it has to actually maintain the complete posture of your body. Okay, it is completely maintaining your body weight on itself. Okay, and the weight, the pelvis is the one that is actually transferring that weight to the femur, and the femur is actually the transferring the weight to the calcaneus finally. Okay, so whenever you see here, whenever actually the weight of the human body is actually coming down from head to toe, right? Generally, due to the effect of the gravitation, the whole body mass is actually redirected down from your skull and finally transferred to each and every part of the appendicular skeleton and finally reaches onto the calcaneal bone. So, to maintain its integrity, the bone calcaneus actually have to have a lot of trabeculae so that it can actually bear down that stress. So that's the reason we can actually say by that evidence, yes, the trabecular bones and the trabecular distribution of different bones may be different in the different sites. And I can say that, okay, when we were talking about the pelvis or when we are talking about the femur, can you tell me what is the weakest part of the femur and what is the strongest part of the femur? Somebody was telling femur. Okay, you can also think about the pelvis, you can also think about the humerus. Okay, can you tell me what is the weakest parts of all these bones? Okay, head is the strongest part. Okay, are you talking about the acetabulum head? Okay, femoral head. Okay, neck is the weakest. Are you talking about femur here? Are you guys talking about the femur here? Yes. Okay, then what is the strongest? Okay, in which part of the femur is much more strongest? Okay, the shaft. Okay, the shaft is much more strongest, right? Because of the thick cortical distribution. Okay, head also is the strongest, yes. But the problem actually, when it is compared, the strongness of the bones is actually determined about its deposition of the calcium. Okay, the head is not actually the strongest because it actually also has got cartilage in them. Okay, and it has got nerve supply in there. Oh, sorry, not nerve supply. It is actually having cartilaginous distribution, and it is most prone to have a necrosis region. Okay, remember, okay, since you got up a very, very interesting point, remember there is a clinical condition that is actually called as avascular necrosis. Have you ever heard of this term? Okay, have you ever heard of this term? Avascular necrosis. Okay, avascular necrosis is actually a clinical condition where the bones, okay, the bones actually do not receive the blood supply and they necrotize. And the most frequent bone to undergo this avascular necrosis is the head of the femur. Okay, avascular necrosis is a clinical condition where the bones actually do not have adequate blood supply and they start to necrose. So, and the most, yes, of course, it can happen in any part of the body, but most commonly it is seen in the head of the femur. All right, it can also happen in your head of the humerus. Okay, and also it can happen in mandible. Okay, yes, when compared to the head of the femur, yes, mandible is also one of the most important organ, actually, to most important bone to undergo avascular necrosis. Okay, it can happen in any part of the body. Okay, doesn't matter, but most frequently seen in head of the femur. We'll talk about that when we are dealing about avascular necrosis, but remember it as a fact, head of the femur actually is the most frequently seen area to have with a complaint of avascular necrosis. Okay, so that's the reason it is not the strongest. All right, so the strongness of a bone is actually determined by the density of the trabeculae, the density of the cortex. That's what I actually wanted to say. Okay, the more higher the trabecular content, the more thick the cortex is, the more stronger the bone is. All right. So you have to try to understand the normal distribution of the trabeculae, the cortex, on every single bone of your body. So that's the reason I wanted to know. I wanted you guys to learn the names of the bones and come over so that we can know which bone has got what kind of a property. Yes, yes, it is osteonecrosis. Yes, it is called as a vascular necrosis, both the same thing. Yes, okay. But you cannot actually confuse it with the osteomyelitis, okay? Since actually Reshma is the one who actually brought this term as osteomyelitis. Osteomyelitis is entirely different from osteonecrosis, okay? How can you actually differentiate? Osteomyelitis patients still have the vascular supply. But here, these patients do not have the vascular supply and they undergo necrosis. So, which means to say, now let me ask you, since you brought up an interesting question, okay, can you tell me what kind of a condition actually will have or will show a complete resorption here? Okay, remission from this whole property. Is it osteonecrosis or is it osteomyelitis? Which one can completely heal? Do you think it's osteonecrosis or osteomyelitis? Okay, osteomyelitis is the one that is actually going to heal, because you see here it is the necrotic tissue that actually been activated, which means to say the bones have already undergone apoptosis and also underwent necrosis. So which means to say it is a completely irreversible change that is actually happening. Okay, but osteomyelitis, now, since you brought up this topic, let us try to understand what actually and how the bones are actually formed. Okay? What is the cells that are responsible for the formation of this trabeculae or the cortex? Somebody? Osteocytes? Okay, to not exactly. Okay, any type of osteocytes that you know of? Okay, osteoblasts are the one. Okay, osteoblasts are the cell that actually controls what? Bone formation. Yes or no? right? Okay, right. Then what else? What else do you know about osteocytes? Okay, other types. Okay, there are other kinds of a condition, other kinds of cells that are actually known as osteoclasts. Okay, what is the function of osteoclasts? What is the function of osteoclasts? Destruction. Yes, they actually deform the bone. Okay, the resorption of the bone is the one that is actually done by the osteoclasts. The formation of the bone is actually done by the osteoblasts. Okay, and now the destruction, the frequent destruction and the frequent construction of the bone actually happens every day, right? Okay, so what is that kind of a condition called? It is actually why is this happening every day? Okay, as a daily basis the bones actually resorb and also try to reconstruct themselves every day. Okay, they are going to destroy themselves and they are going to reconstruct themselves every day, and it is happening because of, why is it happening? So exactly, see, the bones are actually trying to do the osteoblasts and the osteoclasts frequently work a lot because they have to maintain an important ion in our body to maintain the blood calcium level. So now you tell me, what is the main important, uh, important component in our human body that actually controls down the blood calcium level? Uh, no, it is the bone that actually that stores calcium. Okay, somebody says kidney. No, I think you I think you might be talking about adrenal gland when you meant by kidney, Aman. Okay, calcitonin. Calcitonin. Okay, what is the gland that actually produces calcitonin? Parathyroids, suprarenal. Which one? Is it calcitonin or okay? Is it suprarenal or parathyroid? Which is correct? Suprarenal. Are you sure? Then why somebody says it's parathyroid? C cells of calcitonin, okay, C cells of the thyroid gland, actually the one that releases down the, you know, calcitonin. It's not even parathyroid, it's not even suprarenal, okay? But what are these parathyroid hormones doing? Okay, what is this parath hormone doing? Then what is parathyroid hormone doing? What is it releasing? Potassium levels, okay, that's fine, but what else? That is true. They increase in the one. Okay, what is they are releasing parathyroid hormone. Okay, parath hormone. Okay, then what about the adrenal gland, suprarenal gland? What is the adrenal gland doing here? See, a lot of mixed up answers are coming down here. Okay, we will deal about this physiology. Okay, we'll deal about this endocrine part of this particular calcium metabolism when it is coming down in the conditions of osteonecrosis. I think you are not completely, aware of all these things. You have to understand, okay, the formation or the resorption and the destruction or the construction of the bone is actually happening because a lot of endocrine functions. Okay, first, at least try to understand it this way. Okay, the endocrine glands such as the parathyroid gland, the thyroid gland, suprarenal gland, the pituitary gland, and especially the bones, all of them actually working through the fluid medium blood to control the levels of calcium, which is a very, very important ion that is necessary for transport. Okay, muscle contractions, nervous stimulus, okay, response of the nerves, and then when it is comes down to the circulation or a fluid medium, okay, transfer of materials in every cell organelle, it needs calcium. So there is a complete usage every day, a lot of usage of calcium. And despite of all the conditions, Ankita seems to have this calcium deficiency. Right now, we got a problem. So what do you think is going to happen? Okay. So you went where when Ankita went down to the doctor, actually the doctor did not prescribe her an X-ray, that but actually the doctor prescribed up calcium levels, okay, a blood test, and actually it shows that there is hypocalcemia. But do you think if there is less calcium in her blood, do you think that there is less calcium in her bones? Yes, Ankita, answer this question to me. Okay, so you mean to say that you have less calcium in your blood? It means to say there is less calcium in your bones? Martin, what do you think? Benedict, what do you think? The answer is a big no. The answer is a big no. You see here, if there is a release of calcium from the bones, it comes into the blood. So now the blood has higher calcium levels. If the blood has higher calcium levels, which means to say it is hypercalciuria. Yes or no? It is called as hypercalcemia. It's not called as hypocalcemia. But now you found out less calcium in your blood, which means to say, where is your calcium? Is it in your blood or is it somewhere? It may not be also present down in the bones, because you see here, the the bones actually are trying to take it. It is somewhere, and that somewhere is actually being absorbed. It is being utilized. Exactly, it is metabolized. Rather than we can say excretion, we can actually say it is being metabolized. Now you get it. See, less calcium inside the blood actually indicates that the bones are the one that are actually giving down that calcium. So blood is the one that is actually taking down the calcium from the bones and trying to get down into the blood. But still, whatever the calcium that comes down into the blood is being actually metabolized. So that's the reason finally a bone actually, the calcium is the one that actually is a evidence. The blood test of calcium is actually the one that determines some kind of a thing that is related down to the bones. But here comes down a big question when the endocrine system is actually related down to this functional capacity of controlling down the levels of calcium either in bones or either in blood. So unless and until we evaluate a condition that is related down to the endocrine system, we are not going to get a true idea about the real content of the calcium that is present down in the bones. So how are we going to overcome this kind of a problem? I think in first class of radiology general principles, I talked about this condition. If you can remember that one, yes, you will be able to answer this one. So we came to understand that the levels of the calcium that are present down in the blood may be an indicative of the direct levels of the calcium that is present down in the bones. But it may not be evident until and unless you are going to rule out all of your endocrine pathologies. Yes or no? So what is the true indicator? Okay, what is the true indicator of the levels of calcium inside a human body, and what is the test that is actually going to determine you and tell about this one, the calciums? Yes, less amount of calcium present down in the blood is actually called as hypocalcemia. More amount of blood that is present down in the calcium in the blood is called as hypercalcemia. Okay, so now let us say on the reverse way, less amount of calcium that is present down in the bones may be happening because of two clinical conditions. One is rickets and other is related down to osteoporosis. But high amount of calcium that is present down in the bones is actually called as osteosclerosis. So now you tell me, when I'm trying to actually make sure which, if the calcium is present down, the true amount of calcium that is present down in the bones, if I wanted to know about this one, what is the test that I'm going to do? Actually, the answer comes from radiology itself. It is actually called as bone mineral density scan. Yes, do you remember now? I think we discussed about this bone mineral density scan. Okay, bone mineral density scan is the one. Okay, it is also utilizing the radiation. Okay, and then it is actually trying to tell us the real amount of ossification or the real amount of calcium that is present down in your body. Okay, so whenever you are trying to understand the musculoskeletal system, different radiographs and their appearances, we should not be forgetting about a condition that is called as the bone mineral density as well. So when we are talking about the bone mineral density, we are directly talking about the cortex. We are directly talking about the trabecular components and trying to look in different regions and different locations of the same bone. Okay, that is how the evidence comes over. That is the basic thing what actually a conventional radiography does to the skeletal radiographs. Okay, now then actually you have to understand one thing, that when viewed in tangent on conventional radiograph, the cortex actually produces a smooth, dense and white shell, okay, varying thickness, that appears as a dense white band on the outer margins of the bone. So like I'm saying, it is a smooth, it is a dense, okay, and widely appearing band on the outer margins of the bone. That is what you should never forget. Okay, the cortex appears smooth, dense and white shell. Now it is appearing in the periphery as a dense white band. Now let us say if this smoothness or if this density is changed, what are we going to talk about? We are going to talk about, yes, it might be related down to the calcium metabolism. It is related down to the calcium absorption. It is related down to the osteoclast function. It is related directly due to the osteoblast function. Yes or no? Did you get the evidence here? Did you understand why we are actually talking about a lot of physiology, and we are never talking about radiology here yet? Did you understand the reason why? See, whenever we are trying to understand and look down at the cortex, yes, we are looking at its smoothness, we are looking at its density as a white shell, and we are looking at them as the peripheral white bands, which means to say the cortical shadow on a radiograph is giving you a direct evidence that is related down to your osteoblast, osteoclast, endocrine function. Yes. Did you understand this? Is this point clear now? Yes or no, guys? Okay. You see here, when we are trying to look at the cortex, okay, you know that the cortex is the outer covering. We also came to know that the cortex is the one that is actually the most thick, and we also know it is actually a component of the compact bone. So which means to say the compactness of the bone is actually formed by the calcium, right? So when the cortex of the compact bone actually is the one that is actually much more denser, and less dense is the medullary cavity, which is actually the cancellous bone, which contains the trabeculae, blood vessels, and the hematopoietic cells, we came to understand that the main deposition of the calcium is actually happening in the cortex. Okay, and what is the one that is actually maintaining the endocrine functions, and actually the osteoclast and the osteoblast, which are actually present down in the cortical region of the bone, are the one that is actually controlling this? Yes or no? So that's the reason, if there is a loss of smoothness or loss of density inside a cortex, it is actually talking about a direct evidence that is related down to calcium metabolism, endocrine physiology, osteoclast function, osteoblast functions as well. Yes or no? Now is it clear? Aman, Jabelina, Sandra, Raymond, Edna, do you guys understand here? Right? See, so that's the reason we are trying to look at the cortex, not because of other conditions, all right? Okay, so when you are trying to look at the cortex, we are thinking about the diseases that may be related down to its density, because it is giving a direct evidence related down to the endocrine physiology, related down to the osteoblasts, osteoclasts, all right, and the calcium deposits as well. But right now, when we are trying to look at the medullary cavity on a conventional radiograph, actually appears less dense, it appears grayish density and inside the cortical shell. So which means to say it is forming down as a grayish density in between the thick white bands, that is the cortex. Interlaced with them is a fine network of bony trabecular markings. Okay, so where you have a thing that you are talking about, this one, now this is talking about the trabeculae shunts, okay, which is actually the Haversian canal, which is also made up of less amount of calcium. Okay, so which means to say here the osteoclasts are present or the osteoblasts are present. Now you tell me the answer. Are Where are the osteoclasts present, where are the osteoblasts present? If you can understand this, you are going to completely understand the next chapter we are going to deal, which is trauma and fractures. Okay, blasts in the medulla. Okay, osteoclasts are present down in the cortex. Is that true? Okay, see, now right now we try to understand one thing here. Now let us say whenever there is a problem, whenever a bone is undergoing some stress, osteoclasts are the cells that are actually coming down to that location and try to resorb the destroyed bone, and then call for the osteoblasts, which actually come and form the new bone. Get it? Yes or no? Do you understand this thing? Right? I think it's a basic physiology. So whenever there is a frequent stress that is related down to the bones every day, okay, every part of a bone undergoes stress every day. So at that point of time, osteoclasts are the cells that are being there in the cortex, and they are the one that is actually removing, they are trying to destroy the cells which are completely distracted, are damaged, and then they call for the osteoblasts and then come down for the new bone formation. Now I ask you a question. When the trabeculae are completely lost, which means to say the healing mechanism of the bone is affected, yes or no? So whenever you do not have a very, very high dense medulla, do you think that the bone resorption, okay, the bone reconstruction is going to be affected or not? Yes or no? Yes or no? Yes, now let me give you a clinical case and let us try to understand this clinical condition. Okay, a 70-year-old female has fell down in the bathroom, okay, while taking a shower. And an x-ray shows that she has a fracture of the neck of the femur. Now, she has been taken down to an orthopedic department, and now you are there. So, what kind of a decision are you going to take? Are you going to tell this female that, yes, I'm going to put you upon a bandage and you will be completely better and you will be running again? Or you will tell something else? So, what do you determine? Did you understand my question? See, a 70-year-old female fell down while taking down a shower, and when she came down to the radiology department, the x-ray shows that there is a problem which is related down to the fracture of the femur. Okay, now she has been transferred down to the orthopedic department where you are there, and now will you tell this patient that, okay, I will put upon a bandage and I will send you back home, that you will be having better fast? Or you will tell something else. Okay, you are talking about the old bones does not get healed soon, maybe because she is having osteoporosis and she is under the condition of menopause. So what does menopause actually has to do with here, with this condition? What does and menopause has to do with this? Also give her some calcium tablets. Okay, Ankita seems to be really very obsessive with the calcium tablets. Don't you think that if I'm going to take some amounts of food which is having high calcium content, don't you think that I will have enough calcium in a day? Okay, you guys bring interesting topics every day. I like it. Then why do I have to take calcium? Okay, what is the amount of calcium that is necessary for us every day? How much amount of calcium that is necessary for us to the day? Somebody answer this question if you have completed down your, you know, okay, how much of calcium do you need in a day? What should be the intake of calcium? Okay, yes, 1000 to 1200 mg per day. Okay, for females, yes, you are correct. Okay, absolutely correct. Okay, it is 1000 mg for males and 1200 mg for females. And what is the best form of calcium? When you are trying to take it with food, or when you are taking trying to take it with supplementation, which one is the best one? Best for? Actually, it's the supplements which is the faster way. Whenever you have a problem, okay, whenever you are trying to have a problem, because the calcium actually requires metabolism, right? It is actually absorbed in the gastrointestinal system, okay, right? And then, it is actually requires gastric acids for complete absorption. Okay, calcium has to be absorbed. So but when you are taking to take it from the food, actually it takes a lot of time for the metabolism. So when actually calcium is giving down as a supplement in its pure form, okay, so what actually happens, it is going to get metabolized fast and it is going to go down to the target organ fast. But now, what is the inactive form of calcium is? What is the inactive form of calcium? Active form is the calcium, okay, calcium carbonate, you can say, and calcium phosphate. But what is the inactive form? Somebody? It is actually calciferol, right? Okay, 1,2,5 hydroxylase. Yes, you're correct. Okay, calciferol. So you actually require vitamin D for its metabolism, right? With D3, right? And also estrogen is necessary for this one. Okay, estrogen, parath hormone, okay, vitamin D, all of these components are actually concluding that it is determining which function. It is actually determining the osteoblastic function. So when I'm trying to look at the medulla, I am actually trying to look at the trabecular density markings, and the trabecular density markings is a direct indicator for me about such clinical conditions. Now is this point clear once again? Yes? Right? Okay. Now, what actually happens is that you actually see that there is another thing that is actually called as the corticomedullary junction, is the edge between the inner margin of the cortex and the medullary cavity. Okay, the line, the junction that is actually present where the changes of density happens from the cortical region down to the medullary region is actually called as the corticomedullary junction. Okay, now let us say that is the place where actually the transfer of this osteoclast and osteoblast is happening. Now let us say if there is a problem that is related down to the corticomedullary junction, what is the disease I might be thinking about? Now that's an interesting question. Okay, you will try to find out this answer. Okay, when you are trying to look at the corticomedullary junction, okay, when you are trying to look at the corticomedullary junction, what is the one that you are actually trying to find out? Okay, let us take look at this x-ray and then we will take a break. Now you look here, there this is an a okay, what bone is this one? What bone are we looking at? Okay, we are looking at a femur. Exactly speaking, we are not looking at the femur here. We are trying to look at the hip joint. Okay, we're trying to look at the hip joint. Okay, we are looking at the femoral head. Okay, right side, left side. No, I'm not looking at the pelvic anatomy, but I'm particularly looking at the acetabular anatomy, hip joint. Okay, okay, it's a right thing. Right now there is a lot of confusion for us. Okay, whenever you are trying to learn the musculoskeletal system, you have to make yourself sure how to look at a bone. Okay, whenever I give you a bone to hold, or whenever I give you an x-ray, you have to know how to hold it, because this one actually leads down to some kind of a problems. Okay, we'll discuss when I'm talking about the rules and regulations which is related down to the skeletal radiograph quality measurements. Okay, now first you look at it here. I can see a very thick band, thick white band that is present down onto the peripheries of a bone. You see here, so this is the cortex. Now you see here, when I'm trying to look at the diaphysis region or the shaft part of the femur, I can see that the cortex is much more whiter when compared to the cortical shadow that is compared down at the peripheries of the femoral region. So that is what I'm talking about. The cortex also may have a different density. All right. And when I'm trying to look at, you see here, I'm looking at much more grayish substance which has got, transverse lines, horizontal lines, vertical lines, all the way that they are going and redirected down to the head of the femur. You see here, all of them are coming down and coming down as a very, very thick things, and they are going into the direction down into the head of the femur, right? Or let us say that the trabeculae are coming from here to here. Okay, they are directed towards to one part, right? So such thing is actually, I'm looking at much more dense loose areas with little hypodensities in between, but still forming a gray shadow that can be appreciated is the medullary cavity. So you can differentiate it easily that this is the cortex and this is the medulla. Okay, right, this is the medulla. Okay, and you have to see that the junction that is actually formed between the medulla and the cortex here is of also varying density, a little bit varying density. So this is actually the intermedullary junction, corticomedullary junction, you can actually say it, right? Okay, corticomedullary junction. Now my question was, when you are trying to look at this intermedullary junction or corticomedullary junction, so what are the diseases that you are trying to analyze? Okay, maybe you try to find out this answer for me. So let's have a break for 15 minutes. Okay, we will meet back around at 11:45 or 11:50. Okay, all right, so let's take a break here.